Hello, everyone. My name is Marty Guthmiller. I am the CEO at Orange City Area Health System, bringing to you today the 31st edition of our COVID-19 community briefing. The format for today is going to be very similar to what we've talked about in the past, and I do have a couple cautionary things at the end that I'll talk about regarding where you do get your data. Because data is important, and we're going to jump into that right now. First of all, our local scoreboard. We do have 42 positives currently through testing done at Orange City Area Health System. That is of 521 total tested for a rate of 8.1% positive. There's 57 tests more than we tested 5 days ago. So the number of tests is kits and supplies is abundant right now, and you can expect those numbers to continually go up. We do have 10 tests that are currently pending, but again, of no significant concern, primarily because a lot of those, if not all of those pending tests currently are waiting on our pre-surgical patients. Stepping up a level into Sioux County, we do have 423 positives now in Sioux County of the 2,537 tested. The Sioux County positive rate is 16.7%, which is still a little higher than the state, and we'll talk about that in a little bit as well. 1 out of 14 Sioux County residents have been tested at this point, and we've done 325 tests on Sioux County residents in just the last 5 days. So that number is going up as it is going up across the country. And we'll talk about in a little bit more detail in terms of how I evaluate those number of positives. It's important to recognize that in Sioux County, 78% of those 423 positives are between the ages of 18 and 60. That is a good thing as we talk about the acuity level and the way that this disease affects folks. It is more significant in the 61 and over population, no doubt about that. So in Sioux County, 78% between 18 and 60. Region 3 today, the 20 counties in northwest Iowa, is probably the most encouraging news, certainly the best news that we've had in quite a while. In Region 3, we currently have 39 COVID-19 hospitalizations. The number when we talked just 5 days ago was 70. So a significant drop off in hospitalized patients in Region 3. The number of patients admitted in the last 24 hours is 0. I'm not sure that I have ever reported 0 admits in the last 24 hours. So that's, again, very good news. More good news is in Region 3, the number of ICU patients is down to 14. That number was 24 just 5 days ago, so a drop of 10 patients in the ICU in those 20 hospitals. Very good news in Region 3, and I think one of those measures that is markers that's important as we evaluate what's going on around us. Going to the total state then, we have 26,050 positives of 259,005 tested. That is a positive rate of 10.1%. That rate has gone down in the last 5 days from 10.4 to 10.1. The rate yesterday, as an example, in the state of Iowa was 6.4. So we continually can expect that number to go down. Remember, Sioux County rate was at 16.7. So we have a ways to go in the county before we get down to the state level. But again, keep in mind that our rate here at the health system was 8.1%. So all good signs as we move ahead into the future. Now, a little bit of how I analyze the data, and particularly important when you hear about the national number spiking and the number of positives going up. That is important, could actually be a good thing, but it all depends on what's the percent of positive. To me, it's much more important to know the percent positive rather than the number positive, because if for every 1,000 tests that we do, we're going to have 100 people that test positive. And so as the number of thousands of tests increase, we are, of course, going to see a number of positives increase, but that percent is a really important number. The other thing that I layer onto this is the acuity level. How sick are people getting? One of the measures of that is the rate of hospitalizations. So how many hospitalized patients do we have in our region, in our area? And I think that those two measures, percent positive and the acuity level, rate of hospitalization, is two ways to look at it. Don't just look at the number of positives, because you'll be depressed if you do that, because the number is going up. Testing is very abundant now. It's available. And that's a good thing. But you have to look at the data and understand that as well. Looking at hospitalizations then as a key measure in my eyes, the state of Iowa has 181 hospitalizations currently. That's basically steady. We were at 176 the last time we talked. And so that's there, 181. Sioux, Lyon, and O'Brien counties are all at 0. Very good news. That's been fairly constant for quite some time. Plymouth County is down from 3 to 2. So again, only 2 in Plymouth County. Clay County, that we've been adding to our list recently to kind of watch, is 0. So there might be a little more activity in Clay County, but again, the acuity level is not manifesting in hospitalizations. And so that's good. 0 in Clay County. Dickinson County, same thing. We hear about things going on in the Lakes area. And there truly is. There are some outbreaks up there. But again, they're not manifesting in hospitalizations. Dickinson currently has 1 hospitalization. BV County, we've been watching that, down from 23 to 15. Good news there. Woodbury County, another that we've been watching, down from 30 to 22. Polk County, a little bit of an unusual swing there, up from 31 to currently 41 today. It might be interesting also to note that Polk County is, no surprise, the number 1 county in the state for COVID hospitalizations. The number 2 county is Woodbury, and the number 3 county is BV. So in our fairly regionalized basis here, fairly close, we have 2 of the top 3 COVID counties in the neighborhood, so to speak. So Woodbury County at number 2, BV County at number 3. COVID fatigue is a very real phenomena. We are all tired of it. It is emotionally draining, psychologically draining, but it is real, very real. And vigilance is still required for this disease, particularly with the elderly. I don't pay a lot of attention intentionally in this briefing to the number of deaths in the state of Iowa, but occasionally I will talk about them, and I think today is one of those days. We have currently 686 deaths in Iowa. 88%, so by far the vast majority, 88% are 61 and over. 0 deaths in the state of Iowa are under age 18. So it's not affecting the very young in terms of death rate, but it is affecting the very, very elderly. It's important also to note Sioux County has currently had 0 deaths. Plymouth County has had 1. But the number is really tapering off on a statewide basis. It's also important to know that of those 686 deaths, a full 70% were identified with pre-existing conditions. There are others that it hasn't been confirmed of the existence of pre-existing conditions, but a full 70% has. And so that's another reason, and that's why we continue to mention the importance of continuing to address the things that you can address, to control the things that you can control, and to focus on your wellness, from obesity, weight management, to blood pressures, to blood sugars, to colonoscopies, to mammographies. to immunizing your kids, to your annual wellness checks. It's really important to keep that engine tuned, because we most likely all will at some point contract the virus. And the more tuned our bodies are to be able to fight it off, the few pre-existing conditions we have, the way that we've been able to mitigate some of those, because maybe we can't eliminate all of them, but just increase our chances of maybe not even knowing that we had the virus at all. So it's really, really important to maintain that vigilance, to get those wellness things done, make sure your kids are up to speed with vaccines and things like that. It's really, really important. One of the things I want to mention as a caution right now, it's been pointed out to me that there's a Weathercom app that most of us have on our phones, that when you go to it, you can get a COVID-19 update by county. Well, that's might be very convenient, but quite frankly, it's not accurate. And so my understanding was, at a group setting, somebody looked that up and it said 423 positives, which is right for Sioux County. But it also said 180 some deaths in Sioux County from COVID-19, which is completely false. We have 0 deaths in Sioux County from COVID-19. And so there was some angst at this gathering, and why aren't people telling us that? What's going on? You know, that kind of thing. Well, we aren't telling you that because it's not true. So we've had 0 deaths in Sioux County. And so maybe this is another plug for coronavirus.iowa.gov. Take a look at that site. Get your information from that site, not from the Weather.com app. And you not only lower your anxiety a little bit, but you'll get accurate data, as much data as you possibly want. You can drill down at many, many different levels into that. So coronavirus.iowa.gov, and be careful of other sites that purport to give you statistics. As we've talked about throughout the course of these briefings, we ask 3 things: to stay vigilant, to stay strong, and above all, to stay healthy. There are still some rocky roads ahead this fall, but use common sense, live your life, and share some grace abundantly. We've gotten this far. We can finish the race. This is a marathon, not a sprint. But again, use common sense and take care of each other. Thanks again for joining us. We appreciate you listening, and we'll see you next time. Thanks again.